So here's our surveillance report for this week. You can find it on healthygallatin.org. You can see we continue to see a slight decrease in the number of the 7-day rolling average and the number of cases we're seeing per 100,000. It's still above 25 per 100,000, and that 25, we really want to see it below that for a couple weeks to feel better about where we're at. It's a significant number of cases. When you've got this many cases, it becomes very difficult to control transmission through contact tracing. It really is a sign that we've got pretty widespread transmission happening in the community by the standards set by our public health experts and authorities. But it's good that it's not going up anymore. I'd like to see it come down below 25 cases per 100,000 for a sustained period of time and then keep dropping after that. Our positivity rate is similar shape of the curve. It's come down a bit. We're now, where are we? We're at just below 10% for the kind of where our rolling average is. That's better than going up. That 10% threshold is really that point at which you start to see you're probably not getting enough people. You're not detecting cases quickly enough through testing to get them isolated and people in quarantine. So that's coming back down. We'll continue to keep an eye on that. Testing system continues to be in good shape. We're getting test results back in a day. Median time is about a day. Again, remember this from last week, that was really an artifact of, we had a batch of tests that we didn't get into the health department from Big Sky surveillance it was delayed. The contact tracing happened, but the tests didn't come into us until late. Just generally speaking, since the beginning of February, really, we've had a pretty good response with our testing system. Allows us to get those specimens in within a day or two. That's helpful in contact tracing, and because that allows us to start the investigation and get people isolated. I will say, with the number of cases we have combined with the work we're doing in vaccine distribution, our contact tracing, when we're over 25 cases a day, our ability to do really in-depth contact tracing is constrained. We're really getting household members quarantined, doing a little bit more extensive work with the help of the schools and for school kids in school settings. But when we have those higher numbers of overall cases, it's harder to do that contact tracing in the way that we'd like to. You're kind of out of the business of putting out spot fires and more trying to control the overall fire in the community. So that's kind of where we are with that. You can see we've had a bit of an uptick in the number of cases, and that's led to, you can just see the sort of the timing of when people are reporting the onset of their symptoms. That we'll see that this shaded orange area, don't pay attention to that. That's just incomplete data at this point in time. Again, tend to see most cases in people in their 20s and 30s. That 20-something age bracket continues to really lead the pack, and I'll share a little bit more information with you on that. MSU, it looks like 26 new cases during the reporting period, pretty stable compared to what it was last week. 18 active cases. That's positive, good news that we're not seeing rapid increase of cases at MSU. We are seeing cases in schools. The schools continue to work hard on that. We continue to see spread in schools, and the capacity at Bozeman Health, and it looks like we got Laura in today. I'll let her talk about this more in depth. We see good capacity. We have seen an uptick in number of people hospitalized with COVID. We had as many as 12 this past weekend, and it's been between 6 and 10 this week. We had been really in the low single digits for quite some time. It's not surprising when you have a higher number of cases. you tend to start seeing that lagging indicator of hospitalizations come up behind it. Can you all still hear me? Okay. A couple other things that I shared with the Board of Health yesterday, if I can find it here. You see that? No. You see that? So this is from the presentation I gave to the board yesterday. You can see a little bit more shorter term breakdown of the number of the age number of the cases that we've had since March 17th. And you can really see with this that the rapid increase in the number of cases of people in their 20s. And then in terms of vaccine distribution, we're getting vaccine out to people. The older people are, the more likely they are to be vaccinated. That's good news. These are just first doses. You know, of what we're doing here is we're looking at when vaccines are administered in Gallatin County to a Gallatin County resident, gets reported to the state with an age attached to it. We're looking at that and we're comparing it to the estimated population of people that we have in Gallatin County in those age brackets. These are estimates, but it's helpful for us to be able to visualize how many people have been vaccinated. Overall, we're still probably 25% or less of the overall community is fully vaccinated. That's not close to herd immunity that we want. We are getting some good penetration into the demographics, the older age demographics. So you can see, you know, now over 90% of people in their 80s, we're estimating, have gotten at least a first dose. And you can see as you go down, more than approaching 75% of people in their 70s, 66 to about 2/3 of people in their 60s have gotten at least one dose by this calculation. And if you look at fully vaccinated, you can see we're at about 80% of people in their 80s, about 59% of people in their 70s, and then it goes down from there. We are continuing to run pods at our points of dispensing at the fairgrounds. I think we had 17, we're on track to have about 17 clinics at the fairgrounds this month. Those continue to be, we continue to get good turnout. The bottom line though is we need people to get vaccinated now. We have vaccine, we have appointments available. If you go to our website, I'll show you that here. If you go to our website, so here you go to the front of our website. If you go to the COVID section and you scroll down to vaccine information, and then you can hit the clinics, and you can have direct signups to the clinics that we have available. Go into these clinics, and you're going straight into our PrevMod system, and you can sign up for appointments. We really, now's the time. We have those appointments available. I know Bozeman Health has appointments available. These clinics are the efficient way, are really the most efficient and time efficient way that we have to be able to get people vaccinated. We really need people to use them. We have a chance for a much more normal summer, to enjoy a summer that's much different than the last one we had. But one of the biggest variables in that is how many people get vaccinated. If we can get the numbers of people and keep people coming through those points of dispensing, it's going to be much better for our community. When you think about things like the state fair, like Sweet Pea, just the things that we love and enjoy about life here in Gallatin County in the summer, all those things become easier. All those things become safer if we have more people vaccinated. So I really am encouraging people to get out and get those shots. With that, Lauren, you're the top left square, so I'll go with you next. If you have anything you want to add.
Let's try that again. Can you hear me now? Great. Thanks, everyone. I'm Lauren Brendel, Bozeman Health's Public Information Officer. To go off of what Matt has been sharing, to date, Bozeman Health has administered more than 24,500 COVID-19 vaccine doses, which is really, really great, and we are continuing that great work. For May, we are primarily administering second doses to those who received first doses in April. We just wrapped up a fairly big project of administering more than 3,000 doses a week for the month of April, so continuing those second doses into May. We do have vaccine appointment sign-up links available for Big Sky Medical Center at bozemanhealth.org/vaccine. We are working on adding additional sign-up links for Deaconess Hospital in the coming days. And if folks still need a first dose appointment while we're going through May and administering a majority of those second doses, folks are encouraged to call our COVID-19 vaccine hotline. And that number is 406-414-2620. Starting this past week, we were also able to start offering second doses for people that may have received their first dose elsewhere. That would be for folks that received the Pfizer vaccine elsewhere, because that is the vaccine allotment that we are currently getting at Deaconess Hospital. We do want to encourage folks to protect themselves against COVID-19, like Matt said. That gives us the best chance at getting back to normal and back to enjoying the activities of summer that we all enjoy. I also wanted to share that 80% of Bozeman Health employees have chosen to protect themselves against COVID-19, which is fantastic. That's higher than the national average. And I just wanted to share that one of our nurses, Tara, who was immunized back in December and January, shared that she did so because it's important to her to protect the ones that she loves and to set a good example. And we're just really thrilled that so many others feel that same way. We do know that COVID-19 vaccines are safe and effective. We would encourage folks that if they haven't been immunized and might be wary of doing so, to speak with a trusted healthcare provider and research the science from credible sources as folks make the decision to hopefully get immunized in the coming days. I did also want to mention that this morning we were made aware of a scam in Gallatin County claiming a person claiming to be from the hospital is calling individuals canceling or rescheduling their vaccine appointments. And we just want the community to know that this is not us, and that if you receive a call from an individual claiming to be from the hospital or the health system, to please hang up and don't give them any personal information. If an individual does want to confirm their vaccine appointment, they can easily do so by again calling our COVID-19 vaccine hotline, which is, again, that number is 414-2620. And with that, we just want to encourage folks to, again, get their immunizations, protect themselves and their loved ones against COVID-19, and to continue social distancing, proper hand hygiene, and then wearing masks and face coverings in public. So with that, we will turn it back over to Matt.
Sorry, I haven't learned my mute button yet. Tracy, do you have anything today?
I don't have any big updates today, but I'm around for questions. I do have to leave in a few minutes, though.
Okay. All right, we'll throw it open to questions. Questions for Tracy first, since he has to get off, if there are any. All right, questions for anybody then.
Hey Matt, it's Nora with the Chronicle.
Hi, Nora.
Hello. I was wondering first about, been reading some articles about hesitancy rates statewide. It seems like those numbers might be fairly high. So I'm wondering if you have any idea of what vaccine hesitancy rates might be in Gallatin County, and how a statewide sort of number that's higher than I don't know what benchmark there would be, but I'm wondering, I guess, about the statewide impact on Gallatin County. Should there be a lot of people statewide who choose not to get vaccinated?
Yeah, I mean, we don't know. First of all, we haven't commissioned any local surveys to measure that specifically in Gallatin County. I mean, I think we're probably facing some of the same issues that you're facing statewide. Vaccines are, have been the subject of much discussion over the years, and the COVID-19 vaccine is no different. We are planning to do, we're really trying to think through ways to encourage people, to incentivize people to get that shot. And we're also trying to listen and trying to really understand what it is that those concerns are. I always, one of the things that I like to refer people to is the Children's Hospital of Philadelphia has a really nice vaccine page with a lot of frequently asked questions. Dr. Paul Offit runs that organization and has some really good information. That's a really good resource, as well as people's healthcare providers. I think that's another place that they should be going. I don't know that we have a problem in Gallatin County that's any significantly worse or better than any place else in the state of Montana. And if we have low vaccination rates in the state, it's just going to make it harder and slower to get back to normal.
Okay, gotcha. And I was wondering, you had talked about some of the numbers for the older populations when it comes to vaccinations, but I'm wondering about like younger people. Are there any age groups, I guess, below that kind of 60 benchmark that are have any sort of significant numbers when it comes to vaccination rates?
I don't know that we can make a lot of the fact that we have lower percentages in those areas because the vaccine has been available to them much less time. So we'll see. I mean, I think as you get younger, maybe as your perception of risk lessens, we're likely to see people less urgently seeking out those vaccines, and be more important for us to make it really easy, really available, really just almost hard to miss it. And so we're thinking through ways, as I'm sure Bozeman Health and other organizations are thinking through those ways. It'll be important to get people in their 20s vaccinated. We're seeing that is driving transmission. And so if we can get significant vaccine uptake, my fear though is, for some of the same reasons that we're seeing transmission in those age groups, we might see some lack of urgency to go out and get that shot. And so, we're going to be working on that for months and months to come, I think.
Okay, thank you.
Yeah, you're welcome. Other questions?
Yeah, I have a question. Mackenzie Quinn with NBC Montana, and either Lauren or Matt, you can answer this. And I just want to confirm. I actually have two. It sounds like there are now clinics open for first doses. Does that mean that you guys have successfully gotten through everyone on the wait list to get their first vaccine?
For the most part, we're adding to that list. There may still be some people on that list who have not gotten their shots, but they've been offered an opportunity. There may be a really small handful of people who have not, but largely, yeah, Mackenzie, they've had the opportunity. And we'll keep giving them those opportunities if they've missed it the first time. And that's why we went to the direct sign up. We really don't even have that list anymore because we have appointments available and there's no need for a wait list.
Great, thank you. And then my second question is, working with these people who have already received their first dose from maybe a neighboring county, how are you organizing that and coordinating that with your residents who would choose to get their second dose, I assume of the Pfizer, there in Gallatin?
That's tricky because these vaccine comes to us, they're paired. So if we have a clinic today, for instance, of first dose vaccine, sometime down the road in a couple of weeks, we get a batch of vaccine for the second dose for those folks. And so in order to give second doses, it really either causes us to either have to use those first dose allocations or to use a second dose that is earmarked for somebody else. Now, what we've been able to do though, with vaccine supply widening, I think that problem is going to be much less. And as we have no shows, we are more than happy to use those vaccines for people in those categories. It really is helpful if people go to the same source where they got the original vaccine. As we have availability, though, we'll definitely be willing to provide that. It's just that it's difficult for us to be able to give it to people exactly when they want it. We have 2 different brands, maybe 3 different brands down the road. And so be able to provide a vaccine on the day they need it, the brand they need it, and the location they need it can be challenging. We're not unwilling to try, but people should try to plan to get a vaccine from the second dose of vaccine from the same source they got their first dose. And if they can get it somewhere else, great. That there's no problem with that if it's available.
Wonderful. Thank you.
You're welcome. Do you have anything to add to that, Lauren? You're probably dealing with the same things over there. You're still muted.
Sorry about that.
All
I would
right.
just echo your same comments, Matt. As I mentioned, Bozeman Health is primarily getting Pfizer vaccine. So if someone gets a Moderna vaccine elsewhere and then wants to get theirs at Bozeman Health, we would not be able to accommodate that at this time. But if they did get a Pfizer vaccine elsewhere, then we are doing our best to make sure that we can provide that second dose.
Thanks. All right. Are there last call for questions? Are there other questions out there?
I've got one. It is slightly unrelated. How you doing, Matt?
I'm good.
You may have answered in the last meeting last week. I was ushered away from my desk, so I had the video running, but I wasn't not even there for the meeting last week, so that's how it worked. Just following up on the governor's signing of the bill limiting boards of health power. And I looked into that a little tiny bit, skimmed the surface of the iceberg, if you will. But just from your perspective, down the road, do you see this having implications on other parts of health duties outside of pandemic-related things that could be negative?
Well, yeah, I mean, especially for counties, for HB 121 is what you're talking about, I think. And
Yep.
Especially for counties with county health departments, HB 121 is challenging because it really forces those counties with those city-county arrangements. They have interlocal agreements, long-standing interlocal agreements. In Gallatin County, that's between the city of Bozeman and Gallatin County. In the near future, that may be between the city of Bozeman, the city of Belgrade, and Gallatin County. We have those interlocal agreements, and HB 121 forces those commissions, those governments, to cede their public health authority and responsibility to one of those other organizations, to make one of those other organizations the governing authority over the Board of Health. So in Gallatin County, that could be the cities having to cede to the county or vice versa. And that creates concern and creates potential, I would think, concern among those commissions that have responsibility for overseeing and assuring public health. They're being forced to cede control of that to another entity. I think I'll say that there's even today, I heard there's another piece of legislation that's even more problematic. I think it's HB 257 that's potentially devastating to local government's ability to address these clear and present public health dangers. I mean, it really seems to take away the authority of local jurisdictions to do anything to address public health issues. My years as health officer, it's been over 11 years now. We've dealt with surfacing sewage inside restaurants. We've dealt with, surfacing sewage in drain fields. We've had food contaminated with chemicals from refrigeration equipment. We've had rodent infestation. We've had kitchens that are just completely unsafe and unsanitary. We've had a septic hauler years ago dumping sewage directly into a stormwater drain. And so while these things are rare, it's a last resort for us to go to something like a closure order or a restriction one of the reasons they're rare is because we have systems and authority in place to monitor and address those problems early. And if that authority is completely neutered, it creates an incentive for businesses just to ignore those rules altogether. And people should have, I think the public should have an expectation that when they walk into a restaurant, it's safe. And right now, where we are is the vast majority of restaurants are in that position. They're safe, they're clean. But we're a tourism economy to a large extent. If we start to gain a reputation for, that we're the Wild West and there's no local health rules, that's pretty problematic. And so that just came up today. And I think it's HB 257, maybe it's SB, I can't remember. And we've been monitoring that for a period of time. And our concerns about that have fallen on deaf ears. It really takes away the ability of local health departments to do anything seemingly to address issues of public health importance. And so that's headed to the governor's desk. And so, if that gets signed into law, that changes things even to a greater extent than 121. 121, it gives those commissions authority to oversee boards of health. It essentially makes boards of health advisory bodies to the commissions. And it creates some complications in the way that you designate which commission has that authority. But there's some legislation that's moving through Helena right now that's even more problematic than that.
Sure. And my last, just kind of a fine tuning, would that also include like festivals and things like that too? Similar rules with the restaurants when you're looking at the health aspects of putting those things together? Well,
257 deals with businesses. So anything that's a business. And so like we've had one type of business is a trailer court that rents trailers to people who are low income. And we've had instances in the past with surfacing sewage under trailers. We've had instances of sewage not even connected to a sewer system, just being dumped onto the ground. And these are not common. But one of the reasons they're not common is because we have a set of rules and we've created expectations and we've created a culture of there's ramifications if you do stuff like that. If we take away those ramifications, that creates a real risk to the public, and it's really concerning.
Yeah. I think I'm good. Thank you, as always.
Noah, did you have something?
Yeah, I did. Yeah. I was wondering, I think I asked about this last week, but I was wondering a little bit more about some like the outreach the county's planning on. And I guess I'm wondering kind of as we move towards summer, I know there's a lot of seasonal workers coming in or I guess out at this point. So I'm wondering about that piece of it and what kind of your thoughts or plans are at this moment for vaccines to that sort of population.
So we've detailed staff to be a liaison to different organizations, and we're starting with those organizations where we think we can get the most people. We're also any organization out there that can register to be a vaccine provider with the state in order to take the vaccine and manage the vaccine, or wants to hire somebody to do that. That's available right now, and you can get vaccines. So we're really focusing on getting people to the points of dispensing that are currently set up at Bozeman Health, at the health department, community health partners, and other places. But we're starting to reach out to schools. We're looking at chambers of commerce. We're looking at those kinds of places. But again, we have a machine built that can really efficiently deliver vaccines. We can do pretty easily. We can do over 800 vaccine shots a day at the fairgrounds. Really want to continue to use that. As that demand there lessens, we'll be looking at those other options.
Okay, and then last thing, I'm wondering about kind of managing supply as the demand maybe starts to taper off a little bit, and how that process works.
Well, that's changed too, because for a number of weeks in January, February, March, and even part of April, maybe, we really were having a set amount of vaccine that we could get from the state. And we were playing a role in allocating that and making sure that was being dispersed in ways that it could most efficiently be distributed. Now, there's enough vaccine that providers can order vaccine directly from the state, and the local health departments don't have to be arbiters of that. And that's pretty powerful. We're seeing we can get vaccine. And so really it's a matter of planning ahead, ordering it from the state. And if we can be helpful to any organization that wants to do that, we'd be happy to do that. But that's a really dynamic change from where we were a month ago, when we were really having to organize and make sure that every dose, we were really planning where it was going. So it wasn't sitting in refrigerators and freezers. It was getting out as soon as we could get it out.
Okay, thank you.
Yeah, you're welcome.
Lauren, I'm directing this to you because I'm pretty interested in that scam. Do you have any more information about maybe what people should look for in those emails, or however they're contacting people? Are they calling people? And I guess just any more information on that?
Sure. My understanding is that it's a phone call that folks are getting. I don't know if they are using Bozeman Health or any of our other local partners. My understanding is that they're saying they're from the hospital or the health system, and that they need to, that individual's vaccine appointment needs to be canceled or rescheduled. And then they're asking for personal information with which to do that. We are not calling folks to cancel or reschedule appointments. Again, folks can call our vaccine hotline if they need or want to confirm their vaccine appointment, but we are not calling folks to cancel or reschedule appointments. My understanding, when it was brought to our attention this morning, my understanding is that the individual or individuals had reached out to the police, and I believe the county sheriff as well, to report it, but that's all the information that I have. Matt, I don't know if you've heard any additional details on that.
I just heard a little bit about it this morning. One thing I would say to anybody out there, if anyone's calling you asking for personal information, do not give it to them. If you don't know the person, if you don't know the organization, and they are calling you, if we were going to call you, we would have your personal information in front of us, and we wouldn't need it from you by calling you on the phone. Again, we're not calling and canceling appointments. If people want to call our call center, our number is 548-0123. But that is not an issue right now. And if you're getting those calls asking you for personal information or financial information, be very skeptical, be very cautious, and I would not share it.
Perfect. Thank you.
Any other questions out there? Okay, thanks everybody. Have a good weekend.
You too.